Start.
Hi, good afternoon. I'm Ms. Jean Abayan. I am a nursing student from the University of the Visayas. Now I am going to demonstrate to you on how to do the head to toe assessment segment 1. So first, we have to inspect the face of the patient and the head. It should be normal in size and shape, symmetry, and contour. So second is to look at the patient's hair. Note its hair distribution, quantity, texture, color. It should be not too dry or too oily, no scales or... Okay, so step number 3, you have to palpate the patient's scalp. It should be color pink, mobile, and free of lesions. Okay, so let's see whether it's pink. Okay, it's normal. So step number 4 is to use the tips of the middle and index fingers and palpate the temporal arteries. Listen for the words, and you should not hear me. Then we have to use the stethoscope to listen the words.
Go.
You shouldn't hear. So step number 5 is you have to first using your thumbs in the inner aspects of the orbits palpate the frontal sinuses. And step number 6 is to press under the zygomatic bones to palpate the maxillary sinuses slightly across these areas, like this. Ma'am, do you feel any pain or tenderness? No. How about here? No. Okay, how about this? No. Here? No. How about here? Okay, that's good. So step number 7 is you have to move your finger to the patient's temporal mandibular joints. Okay, so you have to palpate with middle finger. Instruct the patient to open and close his mouth or her mouth. Okay, ma'am? Can you please open your mouth? Okay, close your mouth. Alright, so it should be, the joints should move freely and painlessly. Legally painless. Okay, that's good. Now we're going to proceed on how to get the eye assessment segment. So, step number 1 is to test the patient's visual acuity by using the Snellen eye chart. So, if the patient is wearing glasses like me, the patient wear them during the test. So, second step is when the patient standing 20 feet, can you please stand up now? Thank you. And then, so step number 4, the larger the denominator, the poorer the vision. Okay. So step number 5, you have to record each eye and note if the patient was wearing glasses during the test. Step number 6, you have to inspect the patient's eye and external eye structures. So the eyebrows. Okay. They should appear symmetrical. The eyebrows should be free from scaling. The upper eyelids should partially cover the iris, and eyelashes should form upward. Step number 7. You have to test the patient's ocular nerve by asking the patient to close her eyes. Can you please close your eyes now? Okay. Thank you. And step number 8. Gently palpate the eyelids of middles and turners. Okay, you have to be gentle. Okay. Number 9, you have to ask the patient to open their eyes and look up as you refer to the lower eyelids. To inspect the lower conjunctiva, they have the patients look down as you inspect the sclera and the upper conjunctiva. So now, is it right? I'm just going to show you the conjunctiva. So it should be okay. Okay. It's normal. Can you please look down? It should be white. Alright, it's all normal. Palpate the lacrimal apparatus by gently pressing below the orbit. So it should be like this. The pressure should not produce exudate or excessive tears. So step number 11. Place your finger 12 inches away from the patient's eyes and instruct her to watch your fingers as it moves to the upright, far right, lower left, far left, and upper left. Number 12. In testing for accommodation, hold your finger 4 inches from the patient's nose, then ask her to look at your finger, then at the wall behind, then back to your finger. Back to the please look at my finger, and then look at behind my finger, and then look at my finger again. So steps number 13, perform cover and uncover test while the patient stares at the wall behind the examiner. Cup her cover one eye with a card, then observe her uncovered eye. It should not wander or move. When the card is removed, watch the covered eye. It should not wander and move too. Just look at straight. Okay. Same thing, just look at straight. Steps number 14. You have to inspect the patient's cornea. Test his cornea or her cornea, line reflex, by instructing the patients to stare right ahead while the examiner shines a light on the bridge of the patient's nose, 12 inches away from the patient's main face. So if a patient's cornea reflects light in the same spot, the eyes are properly lined. So steps number 15. You have to inspect the pupils patient. So normally they are like 3 to 5 millimeters wide and equally round. So can you look at me now? Okay, it's normal. And then step number 16, you have to check the patient's pupillary light reflex, which assesses the optic and oculomotor nerves. So to do this, darken the room so it's already dark, and shine your light on the pupil from the side. Normally this causes the pupils to concern. I am going to do the ears assessment. First, we have to inspect and palpate the ears of the patient. So, should be symmetrical with no swelling, lesions, or thickening pain. So, do you feel any pain in here, ma'am? Okay. Next is you have to palpate the mastoid process behind the ears. It should be this should be not cause tenderness. Do you feel any tenderness, ma'am? Okay. So next, you have to perform the otoscopic exam. To examine the patient's ear, hold the otoscope in your dominant hand between the thumb and fingers. Then, hold the pinna in the ear up at the back for adults to strengthen the ear canal. Remember, you will need to look in all directions to view the entire tympanic membrane or eardrum. So since we don't have otoscopic, we're going to use the pin light. So now we're going to inspect the external ear canal. You should not see redness, lesions, swelling, and exudate. We're going to examine the tympanic membrane. It should reflect the otoscope's light and should appear shiny and gray. Okay, and then its center should be concave with no perforations. Then you have to note the malleus and the light reflects. Then examine the encus. So next, we're going to assess the patient's hearing by performing the voice, Weber's, and Green's tests. For the voice test, gently occlude one of the patient's ears with your finger, then test the other ear as you stand 1 to 2 feet away from her while asking the patient to close her eyes. Ma'am, can you please close your eyes? Okay. And then you have to gently wiggle using your fingers in her ear while you whisper 2 syllables word. Can you hear me, ma'am? Can you hear me, ma'am?
Yes.
Thank you. So now I'm going to demonstrate on how to check the nose assessment. First, briefly inspect and palpate the external part of the patient's nose. So, alright. it should be fairly symmetrical with no lesions or deformities or deviations. Okay, it's all normal. And now we're going to have the patients occlude one nostril as she inhales and exhales. Ma'am, I'm going to cover your left nose, and can you please inhale? Exhale. Okay, it's normal. Air should flow freely in and out of the nostril. So, next, if the patient reports an impaired sense of smell, test the olfactory nerve by having the patient identify specific smells, his or her eyes closed. So, as she opens one nostril at a time, pass the aromatic substance under the unoccluded nostril. So now, we're going to... can you please close your eyes? And can you please identify what smells is this? Okay. Ma'am, now can you please identify this? I'm going to cover your left nose, and please close your eyes and now identify what smells is this. It's a coffee. Alright, it's a coffee. Thank you. And that's it. So now, I am going to demonstrate to you on how to check the mouth assessment. So first, we're going to ask the patients to bite down and bare her teeth while I'm going to assess for her jaw alignment. So, ma'am, can you please bite your lips? Bite down. Okay. The patient's upper teeth should override the lower teeth slightly. So before examining the mouth, ask the patient to remove his dentures if he's wearing them. So, okay, so inspect the patient's lips. They should be moist with normal color. You should not see any lumps, cracking, or scaliness. Okay, it's all normal. And then ask the patient to close her mouth. Check if the lips close symmetrically. Okay. Now can you please close your mouth? Okay. If you see any suspicious lesions, palpate the lips. It should feel soft and smooth. So be sure to document any abnormal findings. Next, we're going to assess the oral mucosa by using the tongue blade and the light source. So, normally the mucosa should be pink, smooth, and moist, with no lesions and needles. Remember that in a dark-skinned patient, you'll commonly see increased mucosal pigmentation. Then next, assess the patient's teeth and gums. Can you please open your mouth now? Teeth. Okay. Adults have 32 evenly shaped, ivory-colored teeth that are embedded in the counts. Next, we're going to inspect the rest of the oral cavity. The hard palate should appear bony and whitish. So, open your mouth wide. Okay. The soft palate should look muscular and pinkish. And the alveoli should be pink, midline, and free of lesions. So it's all normal. So now we're going to inspect the patient's tongue. The dorsal surface should be symmetrical and slightly rough, with a midline groove and small fissures. Can you please open your mouth and see your tongue? Okay. So the ventral surface should be smooth and pink with visible veins. Now we're going to use the gas pad. So we're going to hold the patient's tongue to one side and palpate the floor of the mouth. So, okay, mom, can you please open your mouth? Now I'm going to put the gas pad inside. Okay. So, you should not feel any lumps or indurations. Now, we're going to ask the patients to stick out her tongue. So, ma'am, can you please stick out your tongue? Okay. Then, it should be the midline and free from tremors. Now, we're going to place the tongue blade at the side of the tongue and ask him or her to push it away. So, ma'am. Okay. Push it away. And next, here. Push it away. Alright. Tongue pressure should be equal on both sides. So, these actions test the hypoglossal nerves. Now we're going to check the glossopharyngeal nerve and the vagus nerve by depressing the tongue and having the patients say ah. Okay, can you please now say ah? Okay. Alright? The soft palate should rise symmetrically and the ovula should stay in the midline position. Can you please say again? Ah? Okay, so their mucosa should be smooth and pink. Grade the tonsils size on a scale from +1 if the tonsils are visible to +4 if the tonsils touch each other. Okay, so now we're going to report the patient's unimpaired sense, then the taste during health history. We're going to assess his or her facial nerves and the glossopharyngeal nerves by having his or her tongue with the tongue blade. Okay, so lightly touch the back of his or her tongue with the tongue blade. Okay, ma'am? Okay, that. Okay, now the patient should gog. This test assess the glossopharyngeal nerve and the vagus nerve. Now, if the patient reported an impaired sense of taste during the health history, assess his or her facial nerve and the glossopharyngeal nerve by having him or her identify different flavors. Okay. Alright, so ma'am, can you please identify what flavor is this? Okay, that's good. And now, lightly touch the back of his or her tongue with the tongue blade. Yeah. Okay. Then the patients should gog. This test assesses the glossopharyngeal and the vagus nerve.